Hello, this is Dr. Gay from First Look MRI, and this is a 63-year-old female who injured her knee recently, lifting her grandchild. A little bit of knee swelling and pain. And on this view, on the right, we have a fat-suppressed view where fat in the bone and subcutaneous soft tissues is dark, so the whole image looks pretty dark, but fluid stands out as bright. So we see a little bit of fluid here in the front of the knee. And this one, fat and marrow are bright, and we can see that the areas back here, subcutaneous fat, bones, Hoffa's fat here are all bright. That's why they look different. And on this view here, we have a different orientation now. Rather than looking in profile, we're looking straight ahead at the knee. And we can see that she has actually pretty good looking knees. This is the medial side of the knee over here. We see a little black wedge, the meniscus, it looks great. A little black wedge over here, the lateral meniscus looks great. The articular surfaces look smooth. There's really no significant arthritis here of the medial compartment or the lateral compartment. Looking good. The ACL is coming down here, looks normal. So on this view, everything looks good, but if we put up the view we began with, the sagittal view, looking in profile, we see that there's another joint. There's the medial compartment here, the lateral compartment here, and there's also an anterior compartment, the anterior knee joint, and that's where the kneecap glides along on the front of the femur. This is called the trochlea. And we can see that this is where the patient's having the problem. So this is articular cartilage lining the kneecap, articular cartilage lining the trochlea, part of the femur. And that cartilage, which is normally a thick gray band going over the surfaces, is completely gone. All we see is bone right up to the margin, bone-on-bone configuration. Don't see any cartilage left. And there's some patchy brightness here. These are little bone erosions where the cortex is eroded through, and there's marrow edema in the underlying subchondral bone. So this is basically just degenerative arthritis, chondromalacia patella where the cartilage is worn through, and now there's bony changes underneath that. And this is associated with an abnormal position of the kneecap. So normally the kneecap, which is this area right here, the patella, will sit much lower. It'll be sitting around right here in front of the trochlea, but instead it's relatively high. This patellar tendon is too long, and so we have this high position of the kneecap, and when it's high in position like this, the kneecap will have abnormal mechanics of stress and is prone to a degenerative change just like this. This is the front of the trochlea, looks like a V, and the kneecap usually, the apex will sit right in this V, but in this patient it's subluxed laterally. The point right here, the midline point of the patella is lateral to the midline point of the trochlea. So we would say this patient has mild lateral patellar subluxation and prominent chondromalacia patella, class 4 chondromalacia patella with a full thickness loss of cartilage and little patchy bony changes there, marrow edema, and that is the cause of her pain. So normal medial and lateral compartments, no meniscus tear, no ligament tear, just class 4 chondromalacia patella related to this elongated patellar tendon and patella alta, high position of the patella. Thank you very much.